How much liquid should my child drink when they are sick? When a child is feeling unwell, keeping them hydrated is one of the most important things you can do to help them recover. If your child has symptoms like vomiting, diarrhea, or a fever, their body loses fluids faster, so it's essential to give them enough liquids to prevent dehydration. But how much should they drink? The answer depends on their age, weight, how severe their illness is, and how much fluid they are losing. For mild illness or early in the sickness, try giving small amounts of fluids often. About 1 ounce, which is roughly 30 milliliters, per hour is a good starting point. This way, they stay hydrated without overwhelming their stomach, which can cause more vomiting. If your child is vomiting, offering fluids in small sips or using a syringe can help. It's better to give frequent, small amounts rather than large gulps that might trigger vomiting again. Using oral rehydration solutions is highly recommended during illness. These solutions contain a balanced mix of salts and sugars that help replace both fluids and essential electrolytes lost through vomiting or diarrhea. Plain water, juice, or soda aren't ideal because they don't restore electrolytes effectively and can sometimes worsen diarrhea or stomach upset. To estimate how much fluid your child needs daily, health experts often use a simple formula based on weight. For children up to 10 kilograms, about 100 milliliters per kilogram per day is recommended. For example, a 10-kilogram child should get around 1,000 milliliters, or 1 liter, each day. For children between 11 and 20 kilograms, add 50 milliliters for each kilogram over 10. For children over 20 kilograms, the need is about 20 milliliters per kilogram. If your child is vomiting or has diarrhea, they will need extra fluids to replace ongoing losses. For mild dehydration, giving an additional 50 to 100 milliliters of oral rehydration solution per episode of vomiting or diarrhea can help. For moderate dehydration, a healthcare provider might recommend giving about 100 milliliters per kilogram over for hours, often in a clinical setting. Severe dehydration requires immediate medical attention, and intravenous fluids may be necessary to restore hydration safely. Some practical tips include offering fluids frequently in small amounts, such as a teaspoon or a small cup, especially if your child is vomiting. Avoid giving large amounts at once, as this can trigger more vomiting. During the first 24 hours of vomiting, it's best to limit solid foods and focus on fluids. Always choose oral rehydration solutions over plain water or sugary drinks, as they help restore the electrolyte balance your child needs. Keep a close on signs of dehydration, such as fewer wet diapers, dry mouth, lethargy, or sunken eyes. If you notice any of these signs or if your child's condition worsens, seek medical care promptly. Remember, every child is different, and it's always best to consult your healthcare provider for personalized advice, especially if your child is very young or has ongoing symptoms. Proper hydration helps your child recover faster and keeps them safe during illness.